All right, I think we're live.
Yay!
Hi, everyone, and welcome to Birth Control Trends Tuesday. My name is Nina, and over here we have our CEO and co-founder of Pandia Health, Dr. Sophia Yen. Dr. Sophia Yen talks about and addresses popular birth control questions every Tuesday, and today we will be discussing topics such as nicotine and low-dose birth control, and regulating periods. So make sure to tune in. Before we get started, make sure that you already have an active prescription for birth control. Sign up for free delivery and automatic refills of your birth control straight to your mailbox. If you need a prescription and you're in Arizona, California, Florida, or Texas, you can sign up for an online doctor's consult with one of our expert doctors. Use referral code TRENDING so we know that exactly right there, so we know how you heard about us. Now, should we get into the juicy questions?
Let's do it.
All right, so the first popular question is, does nicotine cancel out birth control? What do you think?
Nicotine, to my knowledge, does not cancel out birth control. Certainly, we just had a patient who was asking about weight loss medicine. So if you're taking a fat burner, sometimes the ingredients in there revs up your metabolism, and that can rev up your liver, and that can eat up the hormones in birth control, making the birth control not work. The other question about nicotine and birth control, the issue there is if you're a smoker and you're 35, then you cannot take a form of birth control with estrogen. And so those are all the methods that we supply at Pandia Health. The pill, the patch, the ring, all of those have estrogen in them. And the reason why is that the nicotine increases your risk of blood clots. But what's interesting is if you're under 35 and a smoker, it's fine. But if you're 35 and over, then no, you cannot use anything with estrogen in it. However, as a physician, I just have to remind you, don't do anything with nicotine, smoking, vaping, etc., because it does increase your risk of cancer, blood clots, and bad lung disease.
So what would you recommend for people who are addicted to cigarettes and but still want to be safe on birth control? Could you recommend anything?
Absolutely. So what I like to say is, as long as I'm CEO, the only women-founded, women-led, doctor-led company, we will always tell you what's best for your health, even if it doesn't benefit our bottom line. So the progesterone-only options you have, but also non-hormonal altogether, copper IUD. Then the progesterone only is IUD with hormone, implant, and shot. And then there are progesterone-only pills. And there used to only be one kind of progesterone pill, but now there's two types of progesterone pill. The normal progesterone pill that most people know about is if you're 3 hours late, it doesn't work. And you either have to not have sex for the next 5 days, or you have to use a condom. And if you had sex in the past 5 days, you may need to take some emergency contraception because now you're late and you missed it and you're in trouble. The new progesterone-only pill is great in that it gives you a little more space. You could probably be 5 to 12 hours late and still be okay. So it's more like your regular pill, not as evil and strict as the normal progesterone pill. But the negative is, I think it's like $150 or $200 a month compared to the normal, all other birth control pills, approximately $15 a month.
Right, so there's a definitely significant difference between those prices.
Yes.
$15 sounds more
times difference.
Yeah, $15 sounds more affordable in my opinion.
Yes.
So another question is, what kind of birth control is vienna, and how do I know that it's right for me?
That is a great question about vienna. And the reason it comes up is one of the most popular drugs prescribed out there based on a Google search that we did. And so vienna is, I have two issues with vienna. One, that it is 20 micrograms of estrogen. And so I would recommend that anybody who's 30 or under is on 30 micrograms of estrogen or more. If you are on less than 30 micrograms of estrogen, it's not good for your bones. And it's been shown that women that are on 20 micrograms of estrogen versus 30 micrograms of estrogen, these people have lower bone density. So if it was me, my daughter, my friend, my patient, I would not recommend anything with 20 micrograms or less if you're under the age of 30. If you're 30 and above, go for it. But if you're under the age of 30, at least 30 micrograms of estrogen. The other issue I have with vienna is that it's levonorgestrel. Levonorgestrel is one of the older progesterones. And because it's an older progesterone, it has more side effects because now we learned stuff, we made it better, and we made it with fewer side effects. And so the side effects that usually, irritate people is what I call the man side effects. So you have the munchies, or you have zits, or you have hair in places you don't want. Or one that you won't notice unless you check a blood test is it messes up your cholesterol. It decreases the good cholesterol and increases the bad cholesterol. But each person is different. If you're already on a levonorgestrel pill and you're doing fine with it, great. And as we tell our patients when they're trying to skip pills, there are some pills with 84 packs of active pills and then 1 week of sugar pills versus 3 packs of active and 1 week of sugar pills. And this one is cheaper. And so most people do fine on it, but if you're one of the people that notices zits or hairiness or, munchies, then you might want to consider a different one. But the 84 pack is cheaper because it's cheaper.
Right. So you're talking a lot about like age, if you're over or under 30. Are there any other things that you should be aware of, like if you have diabetes or other conditions?
I would say with this drug, there isn't anything specific. My only cons on this drug is that, there's 8 different progesterones, and this is not my favorite progesterone because of the potential for more man side effects. But again, each person's different. And then the estrogen issue. With the individual health conditions, that applies to any birth control pill, patch, or ring. If you have diabetes, it's fine to be on pill, patch, ring, or any of the other methods. It's if you have diabetes and other blood complications. So if you have kidney all these, it's nephropathy or coagulopathy or blah, 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 pathy, because it means that your diabetes has been long or out of control. And so you've had blood clots in all these places. Mm-hmm. And anything with estrogen will increase the risk of blood clots. Also for diabetics, we always like to educate people, anybody with a uterus, anybody particularly on the pill, patch, ring, you don't have to bleed every single month. And the way that the hormones works is it keeps your hormones up for 3 weeks, and then that 1 week off or sugar pills is where you have that bleed. But that week off is optional. And so as a diabetic or a person with seizures or somebody with migraines or somebody with acne, you just do better on a stable hormone than 3 weeks and then drop, 3 weeks and then drop. Anytime you have that fluctuation, not good for diabetes, not good for seizures, not good for headaches, not good for acne.
So you could actually say that it's better for them to skip their period, have their periods be.
Yes. So we're trying to, educate everybody. # periods optional.
Exactly.
Go to pandiahealth.com/periods optional. And on the bottom is my TEDx talk on the science and safety of skipping that week.
Yeah, because I actually thought that it was that it was kind of dangerous to skip your period. I thought that there were some side effects or symptoms or something, and then I found out reading on Pandia that it's totally safe, and I was so surprised. I was like, really? Then why are women bleeding? There's making no sense. Why? It's just inconvenient.
Yeah. It took time and science to realize that being on birth control outweighs the risk of being on birth control. And the main risks are these blood clots. But if you're under 35 and not a smoker, you're good to go on that side, other than, certain health conditions. And then that there's a slight increased risk of breast cancer if you're just on birth control pills. The normal way is 13 out of 100,000. But if you're going to skip that week, then there's more estrogen exposure. So it's 16 out of 100,000. But the slight increased risk of breast cancer is outweighed by the decreased risk in colorectal, endometrial, and ovarian cancer. because every time you build up that lining, you could have cancer, and that's called endometrial cancer, cancer of the lining of the uterus. Every time you pop out an egg, that's ovarian cancer. And so we don't know if it's a popping or the healing, but whatever. One of those causes ovarian cancer. And then the colorectal cancer is, I always love to put the stat out there so women know it's normal. 30% of women, when they're on their period, have some sort of GI problem, diarrhea or constipation. And so that's messing up the gut. And so instead of going up and down and up and down and up and down every single month, if it's just smooth, you don't have that messing up of anything or the gut. And actually, it's more natural to have fewer periods. In the natural state, we would have 100 periods. And now we're having 350 to 400 periods. And then the other hard concept is we as doctors are always like, you have to have a period every single month. And yes, if you're not on medication, you better have a period every single month, or you're pregnant, or you're not eating enough, or you're crazy stressed, or you have a tumor in your head, or you have a thyroid problem. However, if we put you on medications, periods optional.
Right. I don't know. I heard this myth or some concerns about the blood kind of like just, staying in the body because it's not coming out. And that was like dangerous. Now that I'm hearing it, doesn't make any sense. Like, just
good. Yeah. No, I
blood.
think the picture that I like people to see, here's your uterus. And when you're trying to prepare for a baby, it goes, it goes thick, 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 right? So that it can be rich and full of blood to catch the embryo and grow it for 9 months. But when you're on the birth control pill, Patrick, it's just a little bit and it just kind of sits there and it just waits. And then if you can like clean it out every 3 months, every 6 months, every year, but it's not like toxins or anything building up. It's just there. And then the question is, do you want to scrape it off every month, or do you want to scrape it off every 3 months, 6 months, or a year? And I haven't had a period in 10, 11 years, as long as I take my medicine. If I forget for 2 or 3 days, then I get the bleeding. And if that happens to you and you're trying to skip your periods, if you get the breakthrough bleeding, just stop the medication for 5 days, have a clean out, have a bleed, and restart on day 6, whether or not you're still bleeding.
Good tip. Sounds good. Another question is, I use a low-dose birth control pill. Is it still effective?
So the low-dose birth control pill is absolutely effective, but usually less forgiving. So because there's less hormone, if it gets eaten up faster than if you're late, there's a greater chance of pregnancy. Also, it depends on body size. Unfortunately, most of medicine, the joke is made for a 70-kilo white male. So I don't know what their standard was when they did the birth control pill. But if you deviate from the standard, if you're lighter, then you could get away with less hormones. If you're heavier, you might need more hormones. And again, the issue with low dose hormones is a lot of people will go in to see their doctor and be like, I want the one with the lowest hormones.
Right.
But the lowest hormones may not be best for your health. As we discussed previously, if you are under 30, you want at least 30 micrograms of estrogen. If you are lower than that, then you're kind of mimicking an anorexic or a malnutrition person, and then you can't get good bone density. Once you're 30 or above, any dose estrogen is fine. But if you're under 30, you should have at least 30 micrograms of estrogen. So if you're going low dose, then it's not good. The other thing for people to know is when you say low dose, there's like old school and new school. And what it was is when they first invented the pill, 150 micrograms of estrogen. Now we're at 30 micrograms of estrogen. No other drug in the history of time. And they started with the highest dose and then kind of worked their way down. Most drugs, they try to save the drug because it's expensive. And they started the lowest dose and they worked their way up. And I think it's because the consequence of pregnancy is huge and severe. And so maybe that's why they did it, but also because I always like to think they're just screwing with women. But so when we say low dose, 30 micrograms is low dose compared to the original 150, 150 was another standard. And now the new standard is 30-35. And then there's a 20 microgram once you're 30 and above. And then there's a 10 microgram if you're 50 and above. So we have a lot of patients that come in and they're on low estrogen because they're young and their doctor said, oh, they wanted low hormones. So I just gave them a little bit of hormone, but that is too low of hormone and not good for your bones.
So how do you know if it's too low? If the amount is too low, are there any signs?
So if you're having breakthrough bleeding and you're taking the pill every single day, then you are at risk for pregnancy. When there's breakthrough bleeding, it's not working. When you're on the birth control pill, on the active pills, there should be no bleeding. Certainly for the first 2 or 3 months that you're getting used to it, you might have some breakthrough bleeding. And I actually check out our YouTube video, First Time on Birth Control. Here's Dr. Yen's tips. And the key tip that I have is start at the end of your period. Don't just start whenever, because if you start whenever, your uterus is in whatever state and we're throwing on hormones we don't know. If we start on the last day of your period, everything's cleaned out and we're starting on a clean, fresh palate. So I believe when you do that, there's less breakthrough bleeding in your first 2 or 3 months. After you get used to the birth control pill, after 2 or 3 months, there should be no breakthrough bleeding. And if there is, and there continues to be, then you may not be covered for birth control. And you also may be taking like an over-the-counter medication that's interrupting that birth control, or a prescription medication if you know that you're on other prescription medications.
Yeah, I definitely think that's important to kind of get out there, especially for young women who are starting on birth control and don't really know in which direction they should go and all that. And we don't want to have any unintended pregnancies. We want to avoid that.
Yes. And we also want people to have good bone density. And it may not affect you now, but when you're old and you fall and you break your wrist and you wonder why, it's because you were on too low of estrogen for all those years.
Right, definitely. So we have a last question. Can all birth control stop periods?
So obviously the condom won't. A non-hormonal method will not affect your period. So specifically condom, IUD, sponge, spermicide, withdrawal, natural family planning. If you use a progesterone-only method, that can change your period, decrease it, stop it, make it lighter, but it depends on the individual. So 30% of those who use the IUD with hormone normal strength will lose their periods. Yay! And then 70% will get lighter. But I can't tell who's going to be the 30 or who's going to be the 70. And we don't know, and it depends on each individual. With the implant, same thing. 30% will lose their period, 70% will get lighter. We don't know who, we can't tell until we put you on it. Then the shot, after 3 shots, 70% of the people lose their periods and 30% are lighter. And then with the pill, the patch, the ring, you have more control because there's estrogen. And then specifically with the pill, there's 40 different pills. So if this pill doesn't work for you, I got 39 others that I can try, or at least there's 7 or 8 different progesterones and then 2 doses of estrogen that we could play with. So like 16 other options. But unfortunately for the implant and the IUD with hormone, it's only this one hormone. And if that hormone doesn't work for you to turn off your periods, or that dose doesn't work for you, we don't have any other options.
Right. And how about like skipping your period? I read that the patch, you cannot, or is it the ring that you can't skip your period with?
You can skip your period with all 3 of them, but the patch, you should not do it. And therefore you cannot, if you're being safe, more than 12 weeks in a row, because they've shown that already it's a high estrogen. We as physicians think of it as a 50 microgram pill, reminding all of you that 30 micrograms is normal, 20 if you're 30 or older, but 50 is like a lot more than 30, right? Like, I don't know, 2/3 more, 66% more. And so the patch is like a 50 microgram pill. And it might be good if that's the only method that works for you, or if you're taking like Sudafed, which eats up the medicine fast, or anything else that might eat up the medicine fast, you might need the patch. But after 12 weeks of being on it, the estrogen grows more and you're at greater risk of blood clot. So after 12 weeks, we recommend you stop the patch for 1 week, have that withdrawal bleed, and then you can restart. but no more than 12 weeks on the patch in a row without a bleed.
I'm just curious to know, how does the patch work? I've actually never seen it on anyone before.
Oh, yeah. The patch works if you've ever seen the nicotine patch. It's just a way to get drug into your body. And the way it's different and why it's higher is because it doesn't go in your stomach, eaten by the acids, processed by the liver. So it just goes straight into your skin. And so it goes through the skin into your body. And the cool part is you can put it, and you have to check exactly where you can put it. They purposely didn't want you to put it on the underside of your arm or on your breast, because if you got breast cancer, they didn't want you to blame it on them. And it hasn't actually been shown that if you put it in these places, you get breast cancer. But they're just like, if it's anywhere near the breast and you get breast cancer, you're going to blame us. So we don't want it anywhere near the breast. And so it's like upper arm, torso, and buttocks, I believe, is where you can put it. You leave it there for a week. That's really important, because some people are like, I just put it on it for a day. And it's like, oh my God, you were not covered for all those other days. So when a patch is on you, you are covered. When there is no patch, you are not covered. And so you put on a patch, put on a patch, put on a patch. You could go for 12 patches, not keeping them on, only have one patch on your body at a time. And then by the time you want to bleed, at 12 patches, then just go 1 week without, you'll have a bleed and then restart again. But I think it's a great method, except for the dose. So the interesting thing is the current one, there's actually two patches, I forgot. So there's one that is 35 micrograms, and that's the one that we consider as 50 microgram pill. And they just came out with one that's 30 micrograms. And probably because they heard me yell at everybody, you need at least 30 micrograms. But 30 micrograms in a patch is not 30 micrograms in a pill. And so the 30 micrograms in the patch may probably be like 40, 45 micrograms, which is fine if you're under 30. But when you get older, then you have higher risk of blood clots and stuff like that. But there's a new patch out that has slightly lower hormone, but I also don't like the progesterone that they chose in that one. So that one is also, the new patch has a levonorgestrel in the progesterone, but the old patch had a better progesterone, but higher estrogen. So it's all about risk benefit ratio. And that's why we're really proud at Pandia Health that we have expert doctors who provide expert care. And you can see the names of our doctors, the first and the last name, and their photos. If you go to other websites, may not see the same thing.
This might be a weird question, but is it water resistant? Do you have to take it off when you take a shower or anything?
No. So I was actually, my friend at UCSF did the teenager studies, because they'd done the adult studies. They did it in humid climates. So Florida, they did the hot tub study. They did the workout club study, exactly. And it totally sticks. They made it sticky. And actually, sometimes that's a complaint, is you rip it off. And the thing is, you've got like 7 layers of dead skin. And so it may rip off the top layer, just but it won't like bleed or anything. It'll just be a little kind of raw. And then some people have reactions, right? Like my skin is sensitive to everything, and I haven't tried the patch. But like some people, when they get surgical tape, right, they'll get like a reaction. And so that's definitely possible. The key tip, if you're using the patch, is don't put lotion or oil and then the patch, because the lotion or oil is going to eat through the patch and the patch is going to fall off. But you want to put it on clean, dry skin. So not wet, not oily, not soaped, not lotioned or whatever, just clean, dry skin. And generally it sticks on. If it falls off, then you treat it kind of like the birth control pill. If it fall off for 1 day, just put one on immediately. If it fell off for 2 days, put one on immediately. Maybe consider emergency contraception. If it fell off for 3 days and you didn't replace it, then you are not covered and you need to use a backup method for the next week. And if you had sex within the past 3 days, you should take some emergency contraception.
Does it come in different colors? I think that could be kind of cute.
I think that yeah, no, it's uncool because it comes in quotes skin color, which is like this peach color. And so if you are not this peach color Barbie doll, then it doesn't quite work. And so I think it absolutely should have ethnic diversity skin color. But I also think, you and I are confident, and I hope the next generation is also confident. But as we're seeing with Pandia Health, people appreciate confidentiality. And so in my future, I want to ask our patients, do you want your packaging confident or confidential. Right now, we're defaulting to confidential. And the same thing with birth control. It's sad that there's a stigma. You should be proud that you're wearing a patch and you got it covered and we can have sex and I won't be making any babies because I got this on. And so it'd be cool to have it in all these different colors, rainbow, disco, glitter, maybe with, different logos of different companies and stuff like that.
Exactly.
But nobody has the giant ovaries to do that yet. And that's just a shame. And no one has decided to sponsor. It'd be cool to sponsor the patch and have a night at the disco or a night on, Fort Lauderdale for spring break, right? Everybody got their patch on. I mean, they need to work on their marketing. Maybe post that to Twirla.
Or our next business idea right here.
Yes. We're going to bring your patch.
Make a party out of it. Well, I think that was all our questions. So I do want to thank you, everyone.
I want to say hello to Alec and Happy. Thank you so much for being great patient care advisors and tuning in. And I hope everyone will share this video with people.
Yeah, and thank you all for joining, and also you, Dr. Yen. And you're here every Tuesday for Birth Control Trend Tuesdays. So to make sure to check out Pandia Health birth control delivery services at pandiahealth.com and follow us on all our social media platforms. You can find us on Instagram, you can find us Facebook and LinkedIn, YouTube. You can find us everywhere. So
TikTok.
Thank you.
We have some pretty funny videos on TikTok.
We've got some fresh content on there, definitely. All right, thank you again for joining us, Dr. Yen, and everyone out there. Have a great evening. All right.